Okay, well, it is 1 after, so let's just go ahead and get started. Okay, so hi everyone. Thank you so much for joining us today. This is the Integrating Peers into the Workplace Insights from a Missouri Survey of Substance Use Disorder Peers and Peer Supervisors. My name is Brittany Blanchard, and I am the State Opioid Response Evaluation Coordinator at the University of Missouri St. Louis, Missouri Institute of Mental Health. I'm here with a couple of my colleagues that you might see on the Zoom, Bridget Coffey, Lindsay Van Dross, Nico Ruiz, and LP Pulaski. So thank you very much for joining us today. So just to quickly level set, this presentation is really highlighting findings from a survey that we put out, looking at different aspects of how peers are integrated, or rather how they kind of fit into behavioral health organizations across Missouri. So we put out a report recently about these findings, and this presentation is kind of pulled from that, and we'll make sure that everyone has a link to that report at the end. But just very quickly and broadly, we worked with 6 consultants from across the state who are peers or peer supervisors themselves, and they helped us really determine the direction of the project, decide the topics that we explored, helped us create the survey, helped us look at the findings, and are helping disseminate the report, the report and the findings and sharing that information. So 2 of them are with us here today. We have Andreas Prince and Christina Lee, and I will let them introduce themselves in just 1 second. I did want to do just a couple of housekeeping items. So first, just so you know, we are being recorded, and we will put this on our website, and we'll send out a link after the fact in case you want to look back at anything or in case you miss it. Please remember to stay muted. You're welcome to introduce yourself in the chat, as I see folks have been doing. And you can certainly put any questions or comments in the Q&A function, and we will hopefully be done about 10-15 minutes before the hour, and we'll stop for questions or comments at that time. So with that being said, let me go ahead and turn it over to Christina and Andreas, and they can introduce themselves.
Hi, so my name is Christina Lee. I'm a peer case manager supervisor at the DBSA St. Louis Empowerment Center. I've worked there for about 4 years, and I'm also the project coordinator for our Guidance for Goals program through SAMHSA. I was first, I kind of got drawn into this work by accident. A few years into my recovery, I decided to go back to school for human services. And when I went to do my practicum here at the Empowerment Center, I learned what a peer is and what a certified peer specialist is, and just fell in love with it, and was able to start my career here.
I'm Andreas Prince, and I am currently employed at Preferred Family Healthcare. I am a community outreach coordinator and also client engagement specialist. I've been in the SUD field since 1991. I had the pleasure to serve various people with various organizations throughout the United States. I started out as a tech in methadone treatment, and in Chicago. I was mentored by people with lived experience back in the day. Um, I thought it was so cool that they were sort of as I think back, some of the pioneers that opened the door to where we are today. In saying that, I think like having a pathway for future peers to formally continue to be involved in this is so important. Um, and I think we're responsible for making sure that they have meaningful careers. So I am so happy to be a part of this and to share information with you guys and to continue to formalize our processes when it comes to the peer access to providing services in behavioral health.
Perfect. Thank you so much, Christina and Andreas. And at this point, let's just go ahead and jump in. Reminder, any questions you can put in the Q&A, and we'll address things at the end. So let's see, Christina, if you want to go ahead and take us away and talk about what we're going to be talking about today.
All right, so I just wanted to thank everyone for attending this webinar. We're really excited to share our project with you all. So for today's plan, we're going to start with just an overview of peer workers. We're going to go into the research that we did together as consultants, the making and sharing of the survey findings, the what's next part of the project, and then at the end we're going to do some peer reflections and Q&A. All right, so what is a peer? SAMHSA's definition of recovery is a process of change through which individuals improve their health and wellness, live self-directed lives, and strive to reach their full potential. SAMHSA recognizes a peer as people who have been successful in that recovery process and help others experiencing similar situations. So through that shared understanding, respect, mutual empowerment, peer support workers help people become and stay engaged in the recovery process and reduce the likeliness of a relapse. So the idea of peers isn't a new concept in healthcare. Peers have been utilized in other forms for a long time, like diabetes support, cancer support, grief support, and other mental health support systems. Peers are increasingly being integrated into healthcare in various settings. And although peers can work in a clinical setting, peer support is a non-clinical strength-based approach to helping people who are experiencing mental health conditions or substance use disorder. At the Empowerment Center, we are a recovery community center that is completely peer-based, meaning every employee from our front desk to our director to our board has lived experience with substance use. So as a peer, you can wear those many different hats, but at our core, we provide hope, support, we advocate, we model behavior, and guide others through the recovery process. All right, so what we know from the evidence so far is that peer support works. Peers have become an integral part of the substance use disorder treatment and recovery services. Research has shown that peer support helps to increase treatment motivation, retention in treatment, adherence to treatment plans, improves relationships with providers and family members, and it reduces the return to use. I really look at peer support as that bridge that helps connect the individual to the treatment and recovery world, having that shared experience to be able to build trust and can give someone that extra little nudge to help them, just believe in the process and believe they can do it. It gives them hope. So there is some, peer work concerns, and that's what we really wanted to, just dive into. So previous research has identified various concerns that peers experience in the workplace. MIMH has also noted through their community partners and data reporting that behavioral health organizations have difficulty effectively integrating peers into the workplace. And by integrating peers, we mean having them fit in different aspects of the workplace. That includes like having clarity of what one's role is, having your coworkers and supervisors support, and just overall inclusion into the organization process. As organizations increasingly utilize peers to assist in these treatment programs, there's been some problems that have been noted. I can identify firsthand, I love being a peer. It's very rewarding, but it can come with some challenges. And some of the concerns that we've discovered is that lack of role clarity, role drift, maybe, doing a job duty that might necessarily be what you should be doing as a peer. Lack of diversity, which is just something in general in the human service field that we really need some more representation. There's a high peer turnover just because of the stress. We are in recovery, so if you're not getting proper support or taking care of and giving yourself self-care, you can start to lose the value of wanting to be a peer. So with the peer role being so valuable, we want to be able to eliminate some of these concerns and barriers. So Missouri, what are we doing in Missouri? This led us to be curious about what's happening here. And Missouri is actually very progressive when it comes to peer support work compared to most of the country. We have the Missouri Credentialing Board, which you can take 40 hours of peer support training course and receive an official license credential recognized by the Department of Mental Health. So that's just, something I'm very fortunate to be in Missouri that has this very long established support of peer support work. All right, so myself and 5 other researchers, research consultants from across the state were hired to help just support the project and give our unique experiences that we've had. 4 of us were peers and 2 were peer supervisors. The first thing we did was we had a focus group, and really we just kind of came together and had a discussion about our experiences as peer workers, from the onboarding, our trainings, our supervision, things we wish we would have known, when we started, things we'd like to improve, things that are working. And from that, we narrowed it down to some main themes and decided to put this survey together and see what other peers and supervisors also think. All right, so some of our survey goals. We created a survey to see how Missouri peers were affected by some of these things. So our goals include getting a better understanding of practices affecting peer integration, identifying differences between not just, from the peer workers perspective and the supervisor's perspective. We wanted to identify those barriers and facilitators to the integration process and just assess the developmental opportunities, what that career ladder holds for a peer worker. So we shared the survey in many ways. We distributed it through email, different, networkings that we already had. We sent it out into everybody's, contact list, different listservs. We even used snail mail and mailed it to treatment centers and recovery centers. And we dabbled a little bit in social media. And then, at the end, we just were doing those either in-person or virtual meetings where we just promoted the survey. All right, so who took the survey? From that, we had 216 people in all respond. The respondents were primarily 82% white, 74% women, and 36% between the ages of 36 and 45. I don't think we were too surprised with those demographic results. But out of the peer support workers, 88% were certified peer specialists. So I thought that was pretty neat. People are taking, advantage of, what the resources we have to get certified. And almost 50% of the peer supervisors were CPSs as well, which, is excellent having a supervisor who, knows what a CPS is and is a CPS themselves. All right, and then so we also wanted to look into what type of organizations people are working at and where they're responding. So peer workers can have many different settings, both clinical and non-clinical. The top agencies were treatment centers, community behavioral health centers, recovery community centers, recovery housing, and harm reduction and outreach programs. These are at the core of Missouri's wraparound recovery treatment services, with the highest being the clinical with the treatment centers and the behavioral health organizations. So some of the things we found when it comes to onboarding is that less than 50% of the peers and supervisors strongly agreed that initial onboarding and training practices appropriately prepared them for their roles. Also, less than half of the respondents felt that their organization's onboarding process clearly outlined their role. We really wanted to focus on the strongly agreed because if someone only somewhat agrees, I think that leaves room to, what can be made better. Um, there's a difference between someone who's like, yeah, I got great training, and someone that's just like, I guess I got good training, So we really wanted to just highlight the strongly agreed. Um, and for an example, different onboarding processes at my organization, during that initial process, we first review the program manual. We go over different agency rules and policies. Definitely go over ethics and boundaries, because different agencies can have different rules and boundaries. You can work as a peer support, and might be, allowed to take a client in your car, whereas another organization, that's against the rules. So it's really important just to keep the initial training and inform them of all your policies and procedures. We also go over everyone's job description in the center, just so everyone knows who's responsible for what. And then we do a very thorough shadowing and mentoring process. Depending on the position, it could be for a week or even 2 weeks, just to help integrate the new peer worker into the center. So why does this matter, onboarding? Initial orientation of a new peer staff is key factor for the future success in their role and fitting into the workplace. It's really important that the new peer knows what their job responsibilities are, and for other staff also to know how to properly utilize the peer role. And that's just to get the best outcome for the people we're serving and the clients. So I'm going to thank you, and I'm actually going to turn it over to Andreas. He's going to go over some of the other findings we had from the survey.
Thank you, Christina. So I am a super advocate for peers. I advocate for them on all levels. Understanding the peer role. At 50% of respondents strongly agreed that peers and non-peer staff worked effectively together, which for me is super cool, because we're sort of getting a sort of suggests that there's a understanding amongst employer about the impact that peers can have and how to integrate and work together. 55% of peers strongly agreed. Supervisors, 52% strongly agreed. My organization has clear understanding of peer training needs, 47%, pretty high numbers. 32% on the side of supervisors. And understand this, right? So nobody's pointing fingers. It's just a conversation around how we can better change outcomes for peers, so that as professionals, so as we indoctrinate them as professionals, our organizations can embrace them a little bit more. Let me see the next slide. Why does it matter? It matters. All staff need to understand that the peer role and how it differs from other roles that assist clients. Miscommunications can negatively affect peers' ability to fit into an agency, job satisfaction, and staying in their role. So I'm one of those to say I am my brother's keeper. And the peer role is so unique in how it presents itself. So making sure that the role is understood, that other staff understands how to use this as a tool to motivate change, super important. Findings, professional development. 40% of respondents noted that their organization does not have a promotional track for peers. And I think that makes sense, right? Because we just sort of formalized processes related to what peers look like in our organizations. The top 3 professional development opportunities currently available for peers include organizations paying peer trainings, organizations helping peers find training opportunities, organizations paying for CPS trainings. Three other top organizations currently supporting peers as individuals are offering benefits, right? as employees, self-care, mental health days off, employee EAP or employee assistance programs. So for me, professional development so important on both sides of the equation. Um, Mainly being that as we embrace peers into this field, that we sort of alleviate some of the stress and tension that potentially comes with just being a part of behavioral health. It also expands their knowledge base from just not just lived experience, but to take lived experience and make it into some kind of clinical construct so that we can motivate that process and motivate clients in a way that that makes a lot more sense for uh, uh, professional organizations. All right. So support. Um, So for me, support. 70% of peers answered that they have been supported. Does your organization have opportunities for peers to mentor newer or less experienced peers? 70% said yes. 84% of supervisors answered yes. Um, Almost 30% of peers responded did not have an available mentor who had experience working as peers within their organization. 57% of respondents noted that mentors do not receive additional compensation. So here we go. Just another conversation around what the peer experience looks like. And so I'm one that says, let's have a conversation around what it looks like. Let's formalize processes as to what it looks like. For me, peers are sort of frontline people, right? And with peers being frontline people who are actually seeing clients go through their stages of use and stages of change. Oftentimes, it's so important to have people put that in a perspective so that they can stay healthy in their process of becoming a professional in the SUD or other behavioral health fields. Um, just knowing how to become a professional, super important. So I'm a big advocate for support. I'm a big advocate for support because it actually allows our peers to integrate into a process and understand what it's like to become a professional. Also, too, in saying that, I think people that mentor peers should also be compensated effectively, whatever that looks like for your agency, or if you think about your own personal agency, what does that look like? Are we actually motivating people to motivate people to consider every process when it comes to taking the time and efforts to make sure our peers are comfortable being on that front line? Having support staff like mentor or supervisor with lived experience is key to helping peers fit in and work well with other team members. Again, right? I know when I came when I first started working as a recovering person, a person with lived experience, I did not know how to be a professional. So had it not been taught to me, had people not taken time and embraced me, and taught me what the political landscape looks like in becoming a professional. I could potentially been lost or disenfranchised with what we do. Barriers. So some of the barriers. The top reasons that peers find it difficult to continue in their roles. Number one, high stress. I mean, makes sense, right? Like our jobs, on whatever level, as we looked at the statistics, a lot of them had to do with SUD. Um, our jobs are very stressful. We see life and death on a daily basis. And so to affect that process, very stressful. Some days we see clients today, they're gone tomorrow. So very stressful. Poor pay was identified. And I say poor pay because it was like, I mean, we just have to recognize that people should be duly compensated for the jobs that they do. Whatever it takes for our organizations to emphasize that pay structure that reflects a living wage, so be it. Compassion and fatigue. Sometimes we just don't know, right, why we feel a certain way. And so having, again, mentors to sort of share what compassion and fatigue looks like and how to sort of navigate it so that it's not burnout, so on and so forth, so important. Um, but peers have identified that as a barrier. Lack of promotional opportunities. I think because of the peer role being so new, have we formalized processes? Probably not. I will give MCB like the utmost credit because they actually have a track, right, that can take an individual from being a peer to a tech or from a tech to a peer and allow them to sort of educationally move through the system and and experience a process of becoming a career. Overwhelming workloads. What can I say? I mean, it's been identified. I think it will never change in the world of behavioral health. It's just the nature of the beast, but to understand it, to be embraced, to have compassion around it, and sort of a big deal for me because that is where, to me, our organizations play a bigger part in making sure that peers understand what that barrier looks like and not taking it overly personal when it comes to what we're able and capable of doing. Feeling that grievances are not heard. So with grievances, I mean, it's something to take a look at. When people are, I don't know, sometimes I think as we serve individuals and people do not feel that they're being heard, of course, it's dismissive. Um, so I think like when it comes to us being aware of that, if we note this from this study that it is a deal and that it is a big deal for our peers, number 6 on the list that we have to become more aware. And I ask, and often as I look through these questions, I always have asked myself, what does it look like in my agency? What does that process look like in my agency? What does these barriers look like in my agency? And I want you guys to sort of take that in as we have these conversations with other staff or some of our peers, or as we self-reflect on some of the findings with this. Why does it matter? Barriers. Peers, Missouri peers experience many of the same barriers that have been identified in previous research in other states. It is important to address these concerns so that peers stay in their role and can better serve their clients, right? And I think the last sentence of that speaks volumes, right? We want peers to stay in their roles so that they can better serve our clients. I think the motivational process when it comes to our peers being a part of the behavioral health system is so important because if I see somebody that looks like me or have been through some of my experience, it's important to keep them engaged. Also, too, from an employer standpoint, think about how much money we invest in people, trying to get them trained. And so do we want them to leave? No, we don't. And I think this is a great career when we think about engaging people in a way that allows them to reach out or use their lived experience. All right, diversity. Oh, your organization actively recruits peers from diverse backgrounds that are representative of the client populations you primarily serve. 42% of peers said yes. 35% of supervisors answered yes. So, like, diversity. I think, like, this continues to be an ongoing conversation of how to be inclusive to all populations. Um, I want to be politically correct in saying, like, as we look at like DEI sort of changes, so on and so forth, I think sometimes we have to be a little more intentional about making sure that we're able to respond to the populations that we serve. When I think about the disproportionate reality when it comes to, looking at different reports, and the disproportionality between African American men being on death reports or being on overdose reports. Huge big deal, right? Because we want to have populations that are representative of the individuals they serve. So yeah, that's sort of a big deal. Diversity, huge. I think also too, diversity also has this holistic sort of process that allows people to grow and see things a lot differently. A diverse group of peers helps staff feel like like they belong. Make sure that treatment plans are appropriate for different cultures and improves the agency ability to support all clients. So what? So what? So some key takeaways. Where do I start? So for me, I think about, so let me share this. I did not want to take the peer credential. I just did not want to do it. I went to school, I worked in the field forever, just did not want to embrace this peer credential. It was something else to do. However, I must say, how important I found this credential to be, right? Because it allowed me the flexibility to do things I couldn't do in other professional roles. It gave me the compassion and reality around understanding what our organizational responsibilities should be for peers. Education is knowledge and key. A comprehensive understanding of the peer role and responsibilities is vital amongst non-peer staff and supervisors. Increased education about the value and roles of peers is important for successful integration. There's more work to be done. The next step is to further assess how we can make improvements and best advocate for the needed changes. Addressing peer concerns is important to make sure that they are successful in their role. They remain and that they remain in their role and that they can serve clients um, to the best of their ability. So again, right, I like this formalized process. I worked with the ATTC along with SAMHSA probably in 2008. There was a gentleman named Dr. Clark who was over SAMHSA at the time, and he was overly emphasizing that peers should continue to be a part of this work. And so to continue to see this work grow, to continue to see us formalize these processes, so important. I think for me, one of the biggest takeaways is that peers are important, right? These are people with lived experience that we must continue to be accountable to. Accountability being around the fact that a lot of individuals have experienced traumas, or may have experienced traumas and are recovering, right? So our ability to stay aware of what's going on with them, being forthright about, their own stability and health, so important. Recommendations for peers, onboarding. Ask questions during the hiring. This is for peers. Ask questions during the hiring onboard process to make sure you understand the expectations of your everyday tasks, how your performance will be measured, and what goals are expected uh, to work toward. Important, right? So that again, if I don't know how to be a professional, use this as sort of a springboard or an outline as we have conversations with peers around understanding how to become a professional. Because there will be expectations of you professionally as you as you provide services in the field of behavioral health. Two, understanding of the peer role. Have frequent discussions with your supervisors about tasks within your role. Periodically review the peer code of ethics and other resources to refresh your knowledge of the role. Again, learning how to become a professional. I take the opportunity when I meet peers within our company to just have conversations around the clinical processes, and then to sort of marry those processes um, with people's lived experience. Professional development. Identify skills you need to strengthen to be more effective in your role and seek out relevant trainings. Right. So this does not just come natural. I think a lot of times we think it just will just happen by osmosis, but we have to be educated and trained as professionals to know how to be effective. Support. Consider reaching out to other peers at your organizations or local organizations to create a mutual support group. Again, right, having conversations on what that looks like. So important, identifying support systems within your organization. Important, making sure that you are aware of how to stay healthy. So having support in that process should be intentional as you seek out mentorship, or you may or have any other questions and concerns. Having access to somebody to help you with those questions and concerns, super important. Barriers. Develop self-care practices to help you cope with stress and compassion fatigue. I can't say how many times over and over and over, it's important to practice self-care. Um, Countless number of individuals that have been a part of behavioral health will share with you what burnout looks like, what compassionate fatigue looks like. And I think it's important for us to take what how can I say this, what the book definition of it is and what it looks like in real life. Because what it looks like in real life I get home and I can't do anything. Um, I, so I think I'm getting something done and I'm not getting it done. So it's this for real process that potentially happens if we're not practicing self-care. So be healthy, get balance, get mentorship to stay healthy and address the barriers. Diversity. I encourage people to be intentional about uh, talking to people, getting to know cultures, finding out uh, what's different. Sometimes it's uncomfortable, but if you aren't open to, I think, people and the diversity of the people that we serve, it sort of limits your ability to be a super great peer. So just that ability to just be open-minded and to see things and to be intentional about seeing things. And that comes from a lot of different perspectives, whether I'm going to a play or being a part of things in my community. As long as I'm sort of coming in contact with different people, different situations, um, it allows me to grow. All right. Recommendations for organizations. Onboarding, be very clear about what the peer role looks like with your organization during the hiring process. Include examples of core responsibilities, expectations, and day-to-day tasks. Um, Again, I think as we look at the role of the peer and we begin to refine the role of the peer, this is where, as organizations, we really embrace those individuals. We bring them into to the setting of quote unquote family by empowering them with information and letting them know that it's not just that their job is important, but there are truly professional expectations. Some organizations service hour requirements. And if I'm not aware of service hour requirements, well, what is that? Well, you know, you have to see so many clients, you have to provide so many services. And not being aware of what that looks like can be a daunting task for people when they're just trying to navigate how to get this, how to do their job. Understanding of the peer role, maintain an open and continuous dialogue between supervisors and peers about tasks, rationales behind the rationales behind them, so that peers don't get pulled into duties outside of their scope. Um, I think, you know, that focus is sort of speaks for itself, that we have to have a continual dialogue um, around what we're doing as organizations, so that, you know, that we stay focused on the task at hand, and we don't stretch people thin in areas that potentially aren't healthy for them, right? Because everybody can't do everything. Professional development Professional development is a collaborative approach to troubleshoot challenges and problem solve. Um, for me, professional development is sort of the deal where we have to make sure that peers understand um, how to take lived experience and make it clinical by nature. So does that take professional development? Absolutely. So to make sure that peers have access to it, to look at sort of what individuals need, you know, important, because again, right, it's important for my agency to potentially teach this individual lived experience that we have seeing other clients, other patients. It's important for us to teach them how to be professional. Support, ensure that the supervisor and the peer have a collaborative approach and frequent chances to assess job performance, strength, growth opportunities, training needs, not only doing annual reviews. And again, right, just a truly living process. So for me, support. Again, support, because we're talking about individuals that are, again, have experienced traumas prior to and are feeling more healthy enough to work in the workforce, or are recovering people. And so the balancing act and trying to fulfill a job function is incumbent upon us to like make sure that everybody's healthy and they stay healthy. Barriers, ensure that the pay scale for peers is compensatory to the positions with other comparable duties, right? We need a living wage. We need a living wage. I know for me, forever and a day, I struggled when I first began in the substance use disorder field, to have a living wage to take care of my family. You know, sometimes I didn't know where we would eat, but I was faithful enough to know that, you know, I was put in a position to help people, and sort of so other things will be provided for me. And that faith kind of took me to continue to be a part of this field. But it was a big deal for me. It was very stressful. It was stressful to the point that I had to get a lot of mentorship on just how to learn how to make ends meet and continue to do what I love to do. Diversity, broaden your hiring searches to include various avenues like online job boards, peer-run programs, outreach events, social media outlets, email lists, nonprofit organizations, advocacy organizations, community centers. Again, right, stay involved in community for me. And also with diversity, again, I look at if my organization is diverse, then usually I'm hitting all of these different avenues in terms of how I'm coming in contact with people. I feel so blessed because I've been at Prefer since 2003. And so a couple years out for various things. But I got a letter from Preferred, and that letter allowed me to speak to someone that worked there that was in charge of our SUD department, and I sort of shared with her the reality of, who I was and what was going on with me in terms of me supporting my family, and was embraced. And I will never forget that, because we had a conversation over the telephone. And this person still works uh, uh, in the field, right? Not directly in client services, but they're still around. But that spirit of that person, and the spirit of diversity that they embraced, allowed me to still be around today. So
On
training
Hey,
resources for peers.
Andreas, sorry to cut in. I
Yes.
think we're going to be running a little low on time.
All
So
right.
maybe we will quickly review some of these resources, but I do want to let everyone know that these are listed in detail in our report, and we'll send the link to you so you can look at that in more detail and have access to links and how to get it and more information on each. So we'll just be quickly through this. Thanks.
That's Brittany.
Sure.
So again, right, training resources, MCBs, my favorites, some of my favorites. I remember Scott from MCB, UMSL, huge. We're the UMSL training right now. They do stuff, and so yeah, so cool. And then here's the thing, right? Like, just sort of go on the search of looking for SUD trainings, behavioral health trainings, and you will see and find countless number of things related to peers and trainings and all stuff. So here's more resources. SAMHSA, of course, the the all-time leader in providing great trainings on evidence-based practices, evidence-based trainings. We got the peer toolkit. So once you sort of get into the deep dive of what this community looks like, you should be able to find trainings and then talk to supervisors and other peers. I'm done,
Okay,
guys.
thank you.
I'm
Sorry,
done.
we're running,
Thanks,
you know.
Whitney.
Whew,
No,
thank
it's
you
cool.
so much. I appreciate it, Andres and Christina. I wanted to kind of end this portion with some thoughts from you guys. So if you kind of maybe want to quickly give us a sense of maybe what you learned from being part of this project and the research, and then also maybe your biggest takeaway that you would want to kind of share with colleagues or back with your organization.
Mhm.
Christina, you want to start?
Sure. Yeah, so I just love the peer role. And so, being a part of this project and being able to just empower the peer role has been everything. Bringing peers to the table to start having some of these conversations with the researchers and bridge the gap. We provide that unique, authentic perspective, and when it comes to prevention, treatment, and recovery. So, it's just been a blessing. I really enjoyed this and having these conversations, getting this community and, even bringing it to everyone. The biggest thing I'll take from this is everything. I love everything about it. All the conversations we've had, all these topics are very important, and I just want to have more of them. But at the key, I think it starts with supervision. It really does, and mentorship. Getting that proper training and support, right? So it's just more than that initial training, because it's a high stressful, like Andrea said, it's life and death every day with what we're doing, and it's so deeply personal to us because it's our journey too, it's our story too, that having that proper mentorship and supervision is just so vital to make make it be long lasting. So because there's plenty of people, as much as you can have a passion and empathy and love this work, sometimes it can be too much. So that's my biggest takeaway, is just making sure to have these discussions and just support all staff and have that mentorship. So
For me, I'm going to be so brief. I've been around this forever. Um, and forever since 1991. And so this is just yet another evolution that has motivated me to continue to do the work that we do. I am so grateful for that, you know, because at some point I'm like, I don't want to do this anymore. I just want to stay home and work at Walmart and do just that stuff. But this evolution has like continued to allow me to grow in areas that I just did not think were possible. So being a part of research and understanding sort of the dynamics of how things work and making them a part of what we do, it gave me that platform, and for that I'm forever grateful.
Okay, I was not off mute. Okay, thank you so much, Andreas, Christina. Appreciate you. Quick, couple more things before we get to one or two questions. Like I said, sorry, a little slow, a little late on time. For the full report, you can go to the website listed there, or you can scan the QR code real quick. Like I said, we'll also just send this out to everyone who's here after the fact, so you can read it at your leisure. And the last thing I wanted to do, I'm going to actually stop sharing this. And since we have such a captive audience here, we wanted to take a moment to just get thoughts from you guys, right? So I assume a lot of folks in the audience here are either a peer, work with peers, supervise peers. We want to kind of get a sense of your thoughts about what aspects of the peer role you think could use additional research, what needs better understanding. So I'm going to actually, give me 1 second. We're going to put up a poll here. Christina, nod if you can see that. Thanks. Okay. Okay. So briefly, take a quick second. Which topics do you feel are most important to focus on so that the peer role can be successful in behavioral health organizations? Now, we've listed a couple here of things that are kind of top of our mind with a couple of suggestions or, examples for each. But there's also opportunity if none of these are calling to you to write in your own at the bottom. So we're just interested in knowing what folks out there think is really important. What is a good next step? What do we need more research, more and a better understanding about? So we'll leave that up for just another few seconds. But in the meantime, maybe this is a good opportunity to go to Q&A. Does anyone have a question, comment, concern, thoughts?
I think you all did an amazing job.
Thank you so much.
I mean, it's a lot of the stuff that I know personally that I have talked about within my organization, a lot of different topics. So to me, it was like you hit the nail right on the head on a lot of the concerns.
Mhm.
I've had some similar concerns along the way. So it was great to be able to have some defined research, some numbers. Trying to find the research sometimes is just as hard, probably just as hard for you if you had to
Yeah.
do some comparative stuff. So
Yeah.
I appreciate all of you.
Good. Thank you so much. That very kind words. We appreciate you being here. And yeah, just Kim, raise your hand.
I did.
Hi.
Hi. Hi, Rachel. Hi, everyone. So good to see you. Thanks for the survey that you did, for the focus on peer support. It's so important, could not be more important, in my opinion. So I'm your SAMHSA Regional Director. For those that don't know me, I am here in Kansas City, and so glad to, be part of this. I think my question was like, what can us policy wonks, whether it's at the state level or the federal level, do to support this work? We see those barriers. What is there anything you can think of that we can do that we're not doing that would, make peer support, better for us in Missouri and beyond.
Money, 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 money. Continue to fund. No, I say that because, people look at statistics and, they say, oh, things are so much better. And then they pull back the funding for stuff, right? And so I say keep the money coming so that we can continue to educate and keep people in organizations that are making a difference in the communities that they serve. Money.
Yeah, peer services are reimbursable in Missouri. They
Mhm.
are. So it's not
Through
that they're not.
Through Mo Health Net they are now?
Yes.
Oh, okay, then
Somebody can
ignore me.
correct you.
Mm.
Yeah, so
Right.
that's good news. But to that money comment, I'll say, where do you think that starts? Does that start at the federal level or the state level?
Well, I would say yes, because so whatever it takes.
How about this?
like,
As a Fed, I can't advocate for money to, be in our budget, right?
Yeah.
So just putting that out there. You hear what I'm saying?
Yeah.
Hear what I'm putting down? Just kidding.
Christina, go ahead.
Yeah, I was just gonna say,
So I,
just being able to talk about it and reduce some of that stigma and just raise up the role in general, would be helpful because it just needs to be talked about. When you look at some other states that have peer support work, some are way behind. So, maybe if we can have something on a national level and just keep talking it up, keep putting it out there, and make people aware of peer support work.
Thanks, Kim. It's a big question.
Yes.
Anyone else? Thoughts?
I do. And this is something not just for peers, but predominantly, for peers, but also in the mental health field. And I've said this for a very, very long time. And a lot of people say money, 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 and money, money, money for mental health and to help for employee retention. However, what blows my mind is that we are mental health providers and there are not any mental health programs for providers that are initiated from policy down. And why that's not a fringe benefit for us as providers, why there's not a provider program, it blows my mind, especially when we are the ones who, when in the helping field, we are very often the ones who neglect our own because we're trying to help others. And so why that's not policy driven, it's always blown my mind why we are not caring for all of us who try to care for everybody else. So I would like to see a lot of policies prioritize some of our wellness as well. So just throwing it out.
Thank you. Yeah. Agreed. There's about 1 minute left. Anyone have a final question, thought, comment, concern?
thank you for everybody for showing up.
Yes.
Thank you.
Thank you.
We can end there. Thank you so much. I really appreciate you guys. We'll certainly send out, like I said, a link to the report. So you can take a look at those resources and some of the recommendations in more detail. And send out if you have other thoughts as far as what might be, a next step. What do we want to look at? What is important to you as far as peer work? That would be really wonderful. We'd love to hear that. So thank you very much. And everyone else have a great Tuesday. Appreciate you. Bye.